Good morning, everyone. Thanks for coming so quickly. Thanks for tuning in. We obviously all know why we're here. Nunavut has its first case of COVID-19, so Premier is going to speak very briefly. Dr. Patterson is going to run down the details and specifics, and then we'll get into questions. Thank you.
Hoi magatta sivulleq paaminaluna taussima johamninga nunuvat joarnartumik taanna sivullertiuqalima kainalaorluni luta Patterson naluna ijailanga joqqapeqsasittaqui.
Nunavut mi ublacha ublango yok naluna qiyunga taanna nuvarjarnua 19 Nunavut luanilerman taanna nanuleerluni mitsimataling taanna nuvatnarjua taikunga tikihimalerman. Dr. Patterson, wachao unikaren mata takwa kano kamagina mangagu kano taikani pilere nakal na mga tamit sa tilingmi mitsimataling kihenyo kakawak nga Nunavut mga kaitigalugit taana nuban na 19 kiamea piwangita kiamea aitoluiguangito amataan na nubat na 19 kinamea piari ningkut nunabumut nakangita tana takwa kinamea nubat na kakto pahiyak kaungito amma katak titaw gayang ito maanaw yok tana nubat na hilang jwa minduk tay outlamat anana nunabut ilakong itugot tamak talukta nuna yami talukta kawiman nangitukut amakapya tukut aula kapta amamanaw yon numud okaw juwakta ka amakaitigalugit utak kecak taluta ino katigi tini picak taluta ikayok talugit amaihimat taluta tana kayok tigi luta tana anigong natabut nuwan na nunabu iluane halagin natabut amma kaitik kanarwak takata ko nunabu miud kating ngalwak tangi duta ublaluk tangi duta amma aggabot yang miud yang mitsak talugit okaw jikan na pag nunabu miutan na nuwan na 19 halagin natabut ihuliakatang nataban ni nunabu matna. The English version. Good morning. Today I am confirming that Nunavut's first confirmed case of COVID-19 in Pond Inlet. Dr. Patterson will speak to the very thorough, very prepared, rapid response of COVID-19 in Nunavut. But first I want to remind Nunavut of something very important. No one wants this virus. No one brought this virus to Nunavut on purpose. No one deserves to be shamed or blamed at this time. The whole world is experiencing this uncertainty and fear. We are not alone. Nunavut is no exception to this global pandemic. Now is the time for patience, kindness, staying at home. We will get through this together. We will beat COVID-19 in Nunavut. And I just want to remind Nunavut Mute, social distancing. Don't visit. Don't get visitors. Wash your hands with soap and water. We will beat this COVID-19 in Nunavut. And rest assured, Nunavut Mute, we are doing the best to protect Nunavut Mute. Thank you.
I'll pass it back and forth. Good morning. As you have seen and heard today, we have announced that a case of COVID-19 has been detected within Pond Inlet. Since the onset of the pandemic, we knew that no combination of preventative measures can absolutely guarantee COVID-19 will not arrive. We anticipated that sooner or later the virus would be detected in the territory, and just as we poured extensive effort into our prevention plan, so too have we developed a comprehensive response plan to minimize to the greatest possible extent the impact that COVID-19 has on Nunavut.
Ulakut tusaqsimalertut saugatsita kusimalertut saugatsilu ulluminalunaersivugut nuvajuarnartoharninganik 19 qawiyausimayumit simatalimmi tamanna pigialaorsimammaani nuvadjuarnarusiaq mapallianinga qauyimalortugut kisulima qanuiliurutivut nuqqangatitsigasuarutivut tamatuminga atangertumik nuqqartitsisimadjaanginningani nuvadjuarna 19 tikilaarningani niriulaortugut qilamikkut kinguniagulluuni taana nuvadjuarnaq qauyiyaugajarninganik nunavummi taimaatsainaq atsuruuteqarsimagaluaqatta tikititauttailinganinganut parnauteqarsuta aaqqitsuisimayugu atangertumik qanuiliuruteqarnianermut taana qanulima piyunnarnilimaattinni siammapalliaqhunagu nuvadjuarnaq 19 nunavummi.
We have been in contact with Hamlet authorities and have initiated our rapid response plan. The rapid response team is already being deployed to Pond Inlet and is scheduled to arrive early this afternoon. The team will immediately initiate containment measures, begin and assist with contact tracing that has already started, and monitor the health and well-being of persons on home isolation orders. The Pond Inlet Health Center is well-staffed and prepared, and health center operations will continue.
Hoyigiarbigisimajavut haamlakkut iqqanaajartingit pigiartitsissimalluta qilamiujukkut kamagijarnermi parnautittinni qilamiujukkut kamagiartuqatigiinniartut taakkua aullarpallialeriartut mitsimatalimut unnussa tikilangaju tappaunga taakkua iqqanaajartivut pigiatsautigilangaju taannasiammarpalliarrunagu ammalu kikkumnik takujaqarsimammangaa qauisarpalliatsautigillutik qauisarpallianginnarlutillu qanuingigaluarmangaaq taakkua angeqqami anittailititauju mitsimatalimmi aanniarbik iqqanaajartiratsiartut upalungaajarsimatsiartutillu ammalu aanniarbimmi aulataunningi issuli kajusitsiatuinnaniartu.
All passenger travel in and out of Pond Inlet should cease. This includes any movement in or out of the community by land travel. This travel ban is a necessary containment measure to minimize the risk of COVID-19 spreading to multiple communities at once. Until we have determined the potential spread of the virus within the community, all non-essential offices and services will be closed. There is to be no social gatherings within dwellings, and all residents of Pond Inlet are asked to continue to maintain social distancing and good hygiene.
Qangatujukut tikikhattartulimaat aulahattartulimaat pan mitsimatalimmi nuqqartitauju taakkualu ilagijaullutik tikitbiuqattariaqangittut aulaqattangillutillu nunalinni asianut nunakkun taana tikigunnanermu aularunnaanermu nuqqartitaujoq taakkua siarmapalliarrunagit nuvadjuarnaq 19 nunalinnu asianuunqunagillu nalunaissilaunginittinni taanna siarmarsimangikkaluarmanga nuvadjuarnaq nunanganni taakkua pimmariungittunik piliriali allabbinni piyissirautiillu matuniartun taakkua inuuqatigit katiqattariaqangittut illugijaujuni mitsimatalimmiullimaallu taimaasuli kajusitsiaqujautuinnartut inuuqatigit qanigiiluattaiullimalutik ammalu salummatsiaqattarluti.
For residents of Pond Inlet, we recognize that this news may be frightening. However, the government of Nunavut would like to assure everyone that although travel is restricted, you are not cut off from help and support. Critical services will be maintained, and plans are in place to ensure that access to services such as heat, power, water, sewer, and communications will not be interrupted. Our primary focus now is to detect and contain the virus to prevent further transmission within the community and to other communities. Anyone who has reason to believe that they have been exposed to the virus is advised to call the COVID-19 hotline at 1-888-975-8601 between 10 and 6 p.m. or call your community health center. Please do not go to the health center in person unless you're instructed to do so by a health official.
Mitsimatalimmiunut qauyimagaluartunga taakkua tusaqatsat kappianartuuniginni kisiani Nunavut governmakkungit nalunaersigumajukikkulimaanun taakkua tikigunnartut nuqqartitaugaluartillugit isulittarbiqart ilai sulit tarbit hangittut ikayok taugunna mo ikayok sok taugunna mo pitahariahallaritut pijissirautiit aulainarniartut parnattoharsimallunilu tamakkua pijitsirautiu suurlu utquusautiharnermut umaqqutiharnermut imertartauqattanermut kinaaluttauqattanermut tusaqatsalerinermullu taakkua abbiartaujaangittut Turagahaluarnialertugut taimanalunaersikasuarnermik siarmartailititsinermillu nuvadjuarnermik taakkua nunalingni asinginnut nunalingnu siarmapalleahunagu kinatuinnaq suliyorsaruni tamatumunga qanigillahartumaniunermut nuvadjuarnartu talimmut qaujikkartarvut uqaalaqujaulluti nuvadjuarnar 19 ungasittumi uqaalaviugunnartoq 1-888-975-8601 akunningani tajami ammalu 6 unnukkun ubbaluni uqaalaluti nunatsinni aannearbinnu imminik aannearbiliattailit kisiani tilijauguvi aannearbimmeqhanajaqtimuteekunga upagutigunnartuti.
To all Nunavumiut, know that the preventative measures that we have all been taking are more important now than ever. Everyone needs to practice social distancing, stay home whenever possible, and avoid contact with those who are not a member of your household. Together, our efforts can slow the spread of COVID-19. Finally, I remind everyone of the importance of kindness. Now is not the time for blame or shame. It is a time for compassion, empathy, and support for our fellow Nunavummiut. The government of Nunavut thanks all Nunavummiut for their efforts to date. We will continue all efforts to contain the virus and minimize its impact on Pond Inlet and on the territory as a whole. Only together can we all protect our territory from the threat of COVID-19. Thank you.
Nunavummiulimaanu qauyimagitsi tamakkoa siarmartitteilitsimanivu pimmariunerpaangulleqqutaggaullumimu kikkulimaat atuutiharialiit inuuhatigiit qanigiiluattailini hattarlutik angeqqarsimatuinnahattarlusi taimaigunnarnilimaasinnut ammalu katisigat tailihattarlusi angeqqamiuhatigingitatsinnik katutjiluta atsuruutiqarluta sukkaillitigunnartavusiarmagunnarningannuvatjuarnaq 19 hingullerpaami eqqaititsigunga kikkulimaanik pimmariuninganik tunganariaqarnermun maannaujoq pasitsissimagiaqangittugut kangusaarigiaqangitsutalu kisiani ippigusutsiarluta tungansuqatigillutalu ikajorsuqatigillutalu nunavummiuqatittinnik Nunavugavamakkungit huyannamiartut nunavummiulimaanik atsuruutiqarsimaninginni tamatumunga ullumimun suli atsuruutiqainnarniartugut siarmapalleaqunagu nuvadjuarnaq attuiniqaluaqunagulu mitsimatalimmi nunavulimaamilu katutjiluta saputjigunnartuinnauyugut nunavummi tamatumakappianarninganu nuvadjuarnaq 19.
Questions? Yeah.
Ken Driscoll, APTN National News. My question's for Dr. Patterson. I know there's a concern for privacy for the patient, but I'm wondering what more could you tell us about the patient in this case? Were they traveling outside of territory, or is this a case of community transmission?
Ken Driscoll, APTN kunnik luta Patterson maapiriunga takkua qauyimagaluartunga kangunartulerinamu isamaalugiahaqattataatsumunga nuvadjuarnaqtaarsimayumut taana nunavusila taani aullarsimanneqqa.
Thanks, Kent. We don't know yet the full details of how this individual got COVID-19, so we are beginning with our contact tracing to see who else has been exposed to it. If we, through that, we can't figure it out, then we will start, we'll cast a wider net trying to find the source of this individual's infection.
Qauyimangittugu suliqanutaanna nuvadjuarnartaartuqa nirmanga kisiani pigiaqutiqarniartugu kikkunni katisiqattarsimannermanga kikkulluuluqianartumigunnarmangaata qauyigunnangikkuttigu taima qauyisariallakkannilaartugu taanna qannuq taimaa nuvadjuarnartaarnermanga.
I'm also wondering about contacts and contact tracing. Again, you have a need to protect the privacy of the patient, but I'm wondering if you could give us some sort of scale as to whether this person was self-isolating already, or do they have a lot of contacts in the community? How difficult is contact tracing going to be from what you know?
Hai magaluak tu ngai la kangunak tu lirene sama lu kara katigo kisani tat suma katisima jangi khanu khawi saktau ne akat ubalo khanu tigitana aniteli siman nekha ubalo ila khawi magaluak tu ngai jong nak tu ngani taman na mannaw yo taman na khanu mitsi khakka.
Thanks. The individual developed symptoms last week, was swabbed on the 23rd and has been, to our best information, isolating at home since then. The results came back positive yesterday. Staff in Pond Inlet started contact tracing already and have identified close to 20 people who have been swabbed overnight, and those swabs will be analyzed here in Iqaluit probably later today.
Yan na mi kana tema no vadya naktu ni nalo na ko tini ipin ni palya sa yumi ni pinaso ako siula to mi 23 ngotilu ko hawi saktaw talam na khok amalo nalo na tawlo ni tema no vadya nakto hamni ngani tema ngani ang kami ni anit daily titawngin nakto patsanalo na tawlo to tema no vadya nakto hamni ngani mitsi matalim milo kikko katisi mayangi hawi saktaw valle chau tigila to anna bingano tapani avati kasaita ko hawi saktaw gir simalak to unno anik tamanilo hawi saktaw gutingin Iqaluit hawi saktaw gyalan nakto.
So the number of contacts that we've identified so far is low compared to what we've heard about in other jurisdictions, but with more staff in the community, we'll continue those efforts and carry on from there.
Tako katsiu ningi tako simayangi kati simayangi luni tatsama dalo na yaktaw yu katsi na ugalo atay ma takullugi asingin ni kanata me avitok semani uyuni ikana yaktita kanang na ngata ko kayo sigutigi na tavukikku kati simayangin hawi saktaw lotidlo.
Outside of the 20 people that were swabbed and investigations begun on last night, how many current investigations are for COVID-19 are going on in Pond Inlet?
Tako sila tago avati hawi saktamin yu unnoak katsikan yu vatay ma takuyamin hawi saktaw valayo.
Thanks. I had a quick look at it this morning. It's either 7 or 9. It's certainly under 10 people that were waiting for swabs in that community at the moment.
Himik ko sa akong nakawagakit 7 o balon ni 9 tak ila huli tungani tutako metsi matalim me hawi saktaw valet sa tigiyo.
Enemy for the interpretation. One more quick one. The emergency response team. What does that look like? What does that entail?
Tako to avem naktuliran na mo kamagyak to kikku mata kanu itu mata.
The rapid response team is 3 public health nurses who are skilled in contact tracing and have done it as part of their work in the past, and 1 person to provide logistical support, running errands and ensuring that equipment gets to the plane and comes off of it as needed.
Tako hilami uyukut kamagyak to titaw yut pingasut anya hamnang ituliran na mo anya siltit amalo ataw sik tanay kayok tinga pamnay solo sunak ko ta hangata yu mo awlak titaw sa akong nang nakalo ang mga tanalo na yaksigyak to si Mayloni.
Rajni Sharma, Nunavut News. Dr. Patterson, just to be clear here, the contacts that have been identified through the contact tracing so far, are they all in Pond Inlet?
Raj kuning ano na pivalya kunita ko tako si may kati si may yang ilo kawi sakta valya ilo natimit si matalimit.
Yes, so far everybody that's been identified through contact tracing around this individual is in Pond Inlet.
Tako ulumi mo suli kati yaminingi tako yaminingi ilo natimit si matalimit.
Would it be all possible for you to tell us like how long this contact tracing might take?
Hanol tamako hanutigi kamagayaw na katako kati yaminingi hawi sakta ulo tikiku mangata.
We'll probably have a pretty exhaustive list of the contacts over either today or tomorrow. But in terms of figuring out who's been exposed and caught it, that may take longer. And when we discover, somebody a contact has had, definitely has the virus, then we do contact tracing around that individual. So it depends on how much transmission has occurred.
Tako atangirlugit katisimayangi takusimayangi piliraangot sautigi valleamata ullumilunni qauppalunni naluna tauga kannirunnalaartut tako katijaminingi taatsuma nuvajjaanartaarsimayu qauyisartaut siarniartu siarmarbiusimangikkaluarmangaata ubbalu siarmartut sivalleangikkaluarmangaata.
You talked about a rapid response plan that has been put into action. If you can, on a scale of 1 to 10, 10 being confident, how confident do you feel in dealing with this first case of COVID?
Tako ahilamiujukku kamagiarnama parnauti pitsutigillugit 1 mik 10 mut taana 10 akauginerpaarillugu hanu taana sivullerpaanuvajjuanartaartu akaqqijaarutigivuu siarmat teilititaugunnalanganinganing.
I think we've got a lot of things going for us. The last few weeks of the heavy restrictions and the delay in arrival has bought us a lot of time to improve our preparedness with equipment and refining our plans based on feedback from other jurisdictions that have dealt with this. But there's some unknowns in terms of how far it's transmitted and things like that makes it hard to give a number. But at the same time, I'm proud of this team that, 12 hours ago we found out, and they're already in the air to one of Canada's most northerly communities to mount a response. And the health center has already begun the process of tracking this down. So those people deserve a big pat on the back.
Tako amisummata suli naluneersimangitto qauyissamangitavullu kisani tako tikinnasaalaorninga nuvajjaarna pinasuarustigalanni taima piviqartigunnatsaarsimagatta upalungaayaarnermut sunakkutaataarpallianermullu nalunaayayinermullu parnautiinik taima asinginniavittorsimaviuyuni kanatami atortaussimayunik kisani amisummata taakku qauyimanangittu suli qanutigi taanna katiseqattanermangaa taima qatsiuninginni nalunaqqu qarassuaraanga kisani uqaramayunga taakku upigigakki piliriqatigi taakku ikaqqai 12 tuinnaulertu nalunaertaulortillugu taima qangataliriiqqut tappaunga kanatami ukiurtartuunerpaanga ngata ilanginnu nunalinnut ammalu qauyisarpallianiarsuta ila qauyisarpallialertu pikinakkunni katisinnermangaa taakku upigiyautsiaraali taikku piliriqatigi tappaunga palliayu.
Jackie McKay, CBC News. I believe it was yesterday that you spoke about 5 people and how people can interact in Nunavut. I'm wondering now that there's a case of COVID in Pond Inlet, how that impacts social distancing and the movements of people in all other Nunavut communities.
Jackie McKay, CBC kunnik ippatsaqausakalauqabitakku tallimat katiqattarunnalerneraarsugit qanulli taana nuvajjuarnaq 19 mitsaanu qanu attuiniaqqainu qatigi katittaileqattariaqarninginnu.
For now, it doesn't change it. The limit stays at where it was, but we would advise people still strongly limit visits to only those that are essential.
Manno yung ila tamanna asijingit taako katiqattarunnaarningit kisani sulittarbeqartitsillarigiaqalertugu sangijugaarlugu taako malittaugiaqarninginu qatigi katittaileqattariaqarningin.
To clarify, that's outside of Pond Inlet. Within Pond Inlet, we want it to be 0.
Tukisinartigiarlugu taana mitsimataliu sila taana qausiriqataartara kisani mitsimatalimi katiqatta nitsiamarigiaqalertu maanna.
Are you able to tell us if the person who contracted COVID went through isolation in the hotels down south before returning to Pond Inlet?
Ukarong nakita na no badyo naktas mayo aniteli titawlo mga inutuga hakto ni kaluna nito yung may binni.
There's some information that we're just not going to share because we don't want to contribute to blaming or shaming people. Nobody wants to catch COVID-19. Nobody wants to bring it back to their community, and I don't want to contribute to any of that. So there are parts of this that we will not discuss.
Ako ilang ito sa katse, ito saktit sigutaw kaya hangin mata dahil mag ilaleo ko gumangin at pasit sinang mo tamalo kang sa akin ng mo kikulimat siya tama tumingan no badyo anak 19 mitamang sa maktit sigumangit siya kalawang at tamat ko ilang ikaw sa kaya hangit ako sa kajangit siya makitaka.
I heard you say earlier that the 20 swabs that were tested last night will be tested in Iqaluit. Can you clarify if we have testing capacity now in Iqaluit? What you meant by that?
To sa kaga mau hakto tita ko awati khawi saktaw na to tapang tamani khalon ni khawi saktaw na ngata tamani khawi sakto tita khalanga.
Yeah, I think I mentioned at one of the pressers maybe on Monday that we have some capacity in territory and we were reserving it for high-risk situations. This is a situation where knowing right away for a lot of reasons, getting information quickly is obviously very important. So yes, many of these people will actually be swabbed twice, once for our gene expert machine here in Iqaluit, and once for another swab to be sent to the public health lab in Ontario, or to a lab in Ontario, to also be analyzed there.
Pivalya yun ito saktit siya tilo daw kayo gamata ko ilang agupi yun nam nakakatahaw isa kung nam nang mig kasi ani ulo kaya nam nga hubasit tulakhat takwalo tusaw tisa nakakilamik ko pikatang ni man na pimari ulang takwa atong na tabahaw isa ko tita mani pimari yung mata ko lumakwa tita yung mga kawi sa katsani tay ko kawi saktaw yun sana piksibiyo hatang na nga mani kawi sa ko tiyo at tili Jane expert me kawi sa ko tiyo na akto amalo awlak titaw kan ng melodik time ang nagsabi mo kawi sabi mo Ontario me
nali ibulik pa may aperigo tara kikit tarong miutanu ikalong nino kaptahok madating mihu ko ludi at yan nunaling no kakit nagi ikalong miutalik ya uloganak tumihok pa. My first question is, with Iqaluit being the hub of the Iqaluit region, is it at risk?
Yeah, sorry, I was looking for the translation again. Yeah, there's some risk. There's risk that with any community that's had travel between, and this is why we've been asking for people to limit non-essential travel. We are looking at people who've been in Iqaluit on medical travel and reviewing those lists and seeing if there's overlap with the contact list, and we'll work from there to see if there's anybody else we need to be concerned about in Iqaluit right now.
Taman na ilang agulo kaya man nanla no to ina nanalin no pilo at mitama ngak ko sa hatak tilubi kalon no tay may mat Pidyo te hangilo te pimari yun ni awla hatta ko yisi malaw nginata takwala na bila hatta te halon no tamani kikko katiyaw ng mga talo kayo sakta kasi utiga ham na mayo
Nata aperigo ta bunga tikiti chihi magapi kanui kunidlikia pilari ni tikiti china pe amma pekotini nakang na patupiralim ni luni ta kuminga mena kejuti kauna yak dumi kano piliraranya mga piu. I just want to get a bit more clarification on the rapid response team, who that is, I mean, what roles they play, and if they will have equipment that they will use to prevent this from spreading. And does that include stuff like tents, or what kind of equipment that they would need to do it?
Thanks. Their public health nurses, their job is to do the contact tracing. They've got extra swabs, they've got personal protective equipment, and they'll be, in most communities, they'll be working out of the Nunavut Arctic College or the health center to supplement the health center staff. Their job is not to do acute care medical management, so they won't be providing oxygen or starting IVs, some of that treatment that people are concerned about. The plan remains if there are people who are unwell to the point where they can't manage at home, they should be seen at the health center and either get treatment that they need there or be transferred to a facility. In the case of Pond Inlet, it would be here to Iqaluit for further medical management.
Qinnamik takwa anna hannang ituligan ng muila qanayaqti anna asiuqti piyat sa hangnangata kikkunni katisisiman mga kawisaqpallialuni ammalu hakanninga ko kawisaqutissani natsarsimayut ammalu timimu kisulimani sapummiyaut jutini natsartutik takwa silattu sabbimmi ilangi pilirikhattarniartut ubaluni anniarbingani ikajorluti takwa anniarbingani qanayaqtinginnik takwa inulisainaq mo pilirigiartorsimangittut surlu anersaartuutinik ubalo immisortaugutinik taima kamadjaangittut kisiani parnasimayut kinatuinna qanuigunniartumini upaat angeqamini igunnangikkuni aanniarbimmuurunnartut uqaalalaorlutik baloni piloaqqata tappaanga mitsimatalimmiik tamaunga eqalunnutik kititaugajaqtut aulaqtitaulukitoovernertuk qanuiguti qaluaqqata
Kinguleqwa taamna periquartara amihuni nunalingi tuhalawat tapipalliayukku angirtau hemayuni qalliariarearnarmu atjigingitu nunali taakwa kayuhititautuinarnaarpa noqqarlitaulutigluni. My other question is, there were some communities across the territory that were approved to go out fishing derby, their annual fishing derby. Are they still going to be allowed to do their the fishing derbies, or is that completely canceled?
No, those are still allowed. Every community that I've talked to had come up with ways of doing fishing derbies where it's not a public gathering. People go out to the fishing hole, catch the fish, come back, get them measured, and then go home without having that close contact or a community feast or a crowd of people gathering for results. That's still safe. I would not, it should not happen in Pond Inlet at the moment, but for the other communities, it's safe for those to go ahead.
Aga sulitay may gunnaqtitauyut nunalilimata ko tutsiqarsimayut nalunayarsigunarsimammata iqaluliutiyuni katittuqajjaanginningani kamissu qajaulutik taakkualu suurlu iqallialaorlutik angeqqatuinarlutik nirivijjuaqatigiingillutik kikkusaalahammangaata uutturtaulaorluti naalautikku nalunayartautaqqut kisiani maannauyu mitsimatalimitaimegiaqangitto.
Nunavut News. Can you tell me a bit more about what you're doing to protect the person that is tested positive? I realize the rapid response team is flying up this afternoon. Are there any additional steps that are being taken to ensure that this person is essentially safe in the community?
Ema tranto nunatsiakumnik taanna nuvajjoarnaqtaarsimayornalunayartaulauqtu taakkuа qaujamagaluartunga qilamiuyukku kamagiartortu tappaunga pallialinganik qanuiliortuqaqqataanna sapummiyautisaaqullugu nuvajjoarnaqtaarsimayo.
Staff have been asked to touch base with the individual, and notification actually happened overnight and made certain that the medical needs were being met and the individual is either the same or improving as far as symptoms. And I'm not sure if you were intending, but if the question was asking about physical safety from other people in the community, one of the reasons why we're not discussing details about the individual is to respect their privacy and to protect them from stigma, shame, blame, and physical threat.
Tako kanayak tivuta simunga kawigar behafsimayut unwarlo kawikartawlo sunitay ma nupadyanak to karningani. Tako alo kanuing ikalo mga inulis sa utino kawisaktaut sa suni tanalo kanuigun palayo yat sa utigiluni kanu apirikata kabitana tanak tumitay le kullugo asiminik ubalo tay may mat ilulingin ne kawsa kangit dugutan kinauningan alo na ta hungimut tay matsay na kang gusto tita kunago balo pasiyaw si makunago malit siya kahatigo kang unak tulirin mo pihuyay.
I can understand people being concerned. I can understand people being afraid. But anger and blaming individuals when this is not something that anybody wants on themselves or anything that anybody does on purpose is a waste of time and harmful. And so the answer to everybody is that we be kind, we be compassionate, and we be understanding that this is not intentional. This is something that happened, and the way that we'll get through it is, even though we're standing apart, we're going to be working together for as long as it takes.
Tukisiyo magalawak to nga isumalo utakangata kapya sumatalo kisa ni taman na ningan ni pasit sinak kinatuin ng manaw yung takugumangin at tigo tayo mapidyo takangin mat amalo atu tikakaka ni ani natuin na kayak to nilo aperivo nga kisa ni tunga nakatigit sa luta ujek so katigit sa luta tukisiyo makatigit sa luta lo ta napiyarin lo ni tayo may lismangin mat amalo tako o nga sige galawak to tigo pilari katigit sa nakatabo sa pumiyaw sa makulong.
And so this emergency response team, are they bringing additional things like PPE? You know, we don't see all Nunavut wearing things like that right now. I imagine in Pond Inlet, those kinds of things will increase. Is there more PPE being sent there? Anything additional being done at this point for Pond Inlet?
Tako to naktuk ko tapaw ngapti tayo kamagiatok tayo tako nga namat tunik timi mo sa pumiyaw si magutinik surlo matuanik kakanigago natsakat amalo no bumiyaw tayo may tuni atot sangin matakisani mitsi matalimi atok kanira khalaqtut sawni ang tatako tikibiw na katay may tukanang.
Yeah, we're flying in more cloth masks so that people can use those if they have to go to if they have to go to one of the stores and can't maintain social distancing or simply feel more comfortable with that. Those should be in either later this afternoon or this evening.
Tikiti tapang awlak tit sinatigo no sakay tapang atikilang ayot ako ano kat sajay kina mo matuan atok tawagun na kulugit solo ni overbe mo katako yingin at tatay may tuni ni overreacto ni ino katigi yung asigi gahang ningin uno sa tapaw nga tikilang ayot ay may matuan.
And a follow-up on that, are you recommending that people wear things like masks in Pond Inlet right now? I know it's not like a mandatory part of what we've been hearing, but is there any change in your recommendation?
Ilagay ka naglugutak ko matki na mo matuan niya atok ka nakalangalak ka mitsi matalib ni manaw yasego bekangilo ni maliktaw ka simangita kalawat kisanita nasidjak na ka tiliyaw jutigis simayay.
Masks aren't a substitute for social distancing, for washing hands frequently, for all of those other measures. But with that said, it's not a bad idea to be wearing a mask if you're going into the stores, especially when social distancing can't be maintained.
Tako kina mo matuat ima king of beauty yung imatay no katigi kanigilo at tayliga ham ningin nik ang kanilo asay na kataka ham na mo asingin nilo maliktaw gailin ni kasi ani akaw na naksaw yung manaw yung pilawak tuminuvik bilaya hakataw malo ino katigi me kanigi yakaya hakot itay ma matuak si makatarlo ti akaw naksaw sorya ka.
Hi, I have a question from Bob Weber of the Canadian Press. He wants to know if there's going to be an increase of testing in Pond Inlet and other communities as a result of this.
Nagwapik ko ti Bob Weber mo. Takwa amisong kakataw na alakahawisak daw katalang ayumit si matalim miyasingin nilo tayo manukat siya nakto kang ikalaw mga ta.
There already has been an increase in Pond Inlet. with close to 20 tests being collected overnight. I imagine that in communities that often have travel between there and Pond Inlet, there will be increased concern at those health centers, and that's completely understandable, and we will accommodate that.
Ami song reaktor simat litsaw tigayuta ko kawi saktaw hattakto mit simatalim avatikasay kawi saktaw gir simalaksutik takwalo no nali ako sa hattarele hanga tayo kumit simataliti ko nalo nangito ay sumalo ta kalangata tayo mag kawi saktaw gir kan reali tayo matukisiyo manaktabut ikayoksok nakto tigulo.
He's also asking if you can explain the difference between the two tests that are being done, the one that's done in Iqaluit and the one that is sent south, and how long does it take to get results from the south?
Apere medyo tako chigi itu kawi saktaw gutiu yu ay palo hallo nani tayo may gali kamalo nunalini kanu tigi katak ko chak pala katamningi.
The test that's done in Iqaluit is done through our gene expert machine that we've used in the past for tuberculosis, and it once they have the swab, it can be done within a couple of hours. The other test is done at a dedicated lab in the south that can runs same test but is slightly more sensitive, and so our rationale for doing both is the gene expert is relatively new to us. We want to ensure that we don't miss a false negative with the gene expert, and so until we're certain that the machine is working properly and we know how reliable it is, we're going to continue to do both tests.
Tana haloni kawi sakutaw hattakto takuno sunak kutangan atili mo gene expert me atoktaw hattak semayo puvalun naktulinot ikakan ni makko ni tana utik biugun nakto asingilo kawi sakutiyo yut awlak titaw hattak hakasutita kwa sa inay hallo na ano tayo halo na simatsak taw hulugit hallo na ni halo na taw tsak naksagun ng ata pidjuti nga tana atok taw hattak to kawi sakutiyo yumani kilami uyuk ko kawi sak ila kawi hatta ko malutik kasi ane tatigilo dangi tabo manak ko kawi manginata tay manalo na ilaki hatta ko ng mga kasi ane hallo na ano awlak titaw lak tilogin halo na itsalaki hatta ngata.
And I forgot to mention the wait time is typically, with the usual scheduled flights, has been in around 6 days for Pond Inlet. Where we're running charters in and out, the wait time will be less than that, but it will still be at least 2 or 3 days for the secondary tests to be completed.
Tanaw tak kailangan utigiw tak pala hatta mga taman na yung hanga tayo good initially tayo si mayukut ulo ni 6 ni 8 no tak katalaw to kasi ani lakilak tayo si mayo ni hanga tayo tsikhatam na alakata tayo ma nirutugo makko ni ulo ni balupinga suni utak biyo hatam na nitinita ko ni nga kawi saktaw gutingin ni.
Ken Driscoll, APTN National News. My next question is probably for the Finance Minister or the Premier. You guys decide. Pond Inlet has a really well-documented problem with water collection at this point. They have to drive the truck onto the ice and dig a hole every day. One of the best ways to stop the spread of COVID-19 is through washing your hands. I'm wondering what steps is the government of Nunavut going to take to help Pond Inlet better acquire water?
Kent Driscoll APTN kunik kinayaleri kunot ubalo sidulak timo apekuti mitsi matalim mito sa matsiakat ko inaptakatam ningin note akaw ngiliro tsahanga taman na yok sikumo hattara haksuti miksu hattara haksuti ullu tamatan na ilagi mau salumatsara han Nunavut nak 19 ta hunagit kanu iliro ta wataman na samalo tayo.
Thanks for the question. The CGS will be flying up a pump there, and the pump will be set up on the shore of the reservoir, and there'll be a suction hose put through the ice to the pump and discharge hose from the pump to the water truck. This is a manual chlorination into the water truck, and the pump is set up temporary and has to be, the pump would have to be taken out daily and put back daily in the morning. Takwa mano yu takwa government ikut no
Millout.
middo out mi nakyu tinya mata michi matlimu ta na hubli de khalo ni middo outing mit tahamut amma taking a middo outing mit imertaw mut mata na imertaw ta ko tay ko chapis ko ya to chlorine mi ilre taloni ta na middo oti ubdutama ublat tama pia taw taloni an unukut ublakut iliyaw kanafli qaqali lang iman.
Rajni Sharma, Nunavut News. Just a quick question for Dr. Patterson, please. Dr. Patterson, you mentioned previously it was just a matter of time before COVID-19 would come into the territory. So my question is, are you at all surprised it's here now, or were you expecting it to arrive later?
Rasama Nunavut Pivalia Kuniluta Patterson Ukatayoga Vitana Hangatu Natiki good naming and Nunavut Huaksala Kate of Balo Neru to Nalaki.
Well, I was hoping, like everybody else, I think the last few weeks got us into, for many of us, into a bit of a false sense of security. And I think it's proof that, you need multiple layers of defense, for lack of a better way of putting it, and still need that plan to respond for when it comes.
Dai makikilimati to isumalaw akto tikikuna gutama pinasa ko si mayuniki makakiyaktu yatu nalilaw at tikijangin ni ngani kisanita na nalunay kutiyo kutin nilirinik sa pumiyaw juti sani pamnaw tikat sa rakam ni nintana kay naktilo ila tikit naktilo no wadjana Nunavut.
Nope, go ahead.
Sorry, so I was just wondering, were you surprised at this point?
No. We've been braced for it for a while. I think the surprise is more that it's taken this long to get here.
Khwasang ng mga apiritsyakto ima upalong ilaw kata aga khwasang itsyakto nalunang itaman na tikinner ninga tikinner law kalwa ila tikilam ninga niriw na tuin na law to kisya ni khuviat nga tikin na sa jumilaw ninga ning.
Do I have to say it again? Jackie McKay, CDC. I'm just hearing from a colleague now that Iqaluit Eagle has COVID testing that has been approved by Health Canada. They're saying that the GN, their turnaround time is about 3 hours, and that the GN hasn't reached out to them about possibly using that lab to test for COVID. I'm wondering why the GN hasn't done so.
Jackie McKay, CBC, nito sa mama kanaya katinganita ko yan na big agni ko igo ko no wadjong nakto siuti ni kaw isaw te hangata ang yaktaw si mayumi kana tami ana hamnang itulir jak jwa kunut dinga suni kakkanik kaw yiga so ako taw kun naktumik o kasi malutid no nabuga ba magkungi kayok taw gumangin matagu sulit takunungan no nabuga ba magkungi kayok taw gumanyakan.
We have diagnostic capacity on the way to Rankin Inlet, which will be able to do this in a more rapid, in a rapid fashion anyway. When I spoke with the medical director of the people doing the lab work at Iqaluit Eagle Mine, they're doing a different collection method, and we don't know if that collection method can be frozen in transit or not. So it may or may not be appropriate for outlying communities to collect that way and then ship it to Iqaluit Eagle, and shipping from Pond Inlet to Iqaluit Eagle will take more time than shipping to here anyway.
Hawi sakutinik tema sunakutaanik tikitit sinaaliratta kangersinermut ammalukila miunersakkuut utirbiuqattarunnalaarsutik uhabbigissimayangatayna naaharnangittulernermu kamayingaat aagniikku iigukkunni adiungittumillunu atsiqattangata hawisartaugutinik hawimannatalu taakkuuquartitaussimakainnarunnermangaata aullartitau tikititaugasuartillugit kisiani aagniikku mitsimatalimi aagniikku iigumu aullartitsi gasuarut akuniunersaugayangaat qallunaanoortitsituinnakeennaqqattalangajugu.
It's also my understanding that Baffinland has set up a similar type of lab to Iqaluit. Are you considering reaching out to them to try to use that facility?
Tusarsimallutilu taakkua Baffinlaakku nulujaani ujararnaatikku taimaatsainnaarsunakku taaharngata aagniikku iigu pingatitut teikkununga ikajortaugumalangati.
It's logistically feasible once they get their validation work done and get Health Canada approval. And I'm not sure if they've completed that at this point. The other bit of information we need to know is how reliable this test is. There's no medical test in the world that is 100% reliable, so we need to know that rate of false negative, false positives with this testing that they're doing.
Taima ajornaqajangittuugaluaq ammalunalunanngasuliaana harnangittuleriyikkunnu kanatamangertausimammangaatassuli kisaani qawimagiaqaqayaqatta taakkua tatigiyatsaut-siaqaluarmangaataassuurlussulijunnik ubbalu sulingittunik saqqirutauqattaqajarmangaata qawisaqutiuyu nuvatsuarnartuqarmangaata.
News. So you said 20 people have been tested in connection with this person who's tested positive. That's a lot of people. Are there any additional steps being taken to ensure that these other people being tested can self-isolate in Pond Inlet? Maybe if they live in an overcrowded home, what's being done to ensure that that happens?
Amatraantuununatsiakunnik uhaqqauguvi avati qawisartausimalernerarsugi taakkuamisuummata qaakkanningagu qanuigiahartitaulangavaat suurlu anittailugiaqarluti tapaani mitsimatalinmi qanorlikia illumiuqatigi amisualuuppata tamanna qanuiliuqutaugayaqa.
Thanks. The staff on the ground are looking at everybody's situation for consideration of isolation or reverse isolation. And the Nunavut Housing Corporation has forwarded us a list of house units that may be available if the need arises.
Huyanami iqqanayaqti tapaani nisumarsarsiuruteqarsimayu anittailigiaqartohaqqat inutuugiaqartohaqqalluunniit Nunavummi illuleriarjuakkuunnalunaersissimayu illuni innuttausimangittuni atoqqaugunnaqajartuni inutuuvitsaugunnaqajartuni.
And the charter that's being used to send tests from Pond to Iqaluit, can you let me know when someone's swabbed for COVID-19 in the community, how long the charter to take off, come here for the test to be completed? You said it takes about 2 to 3 days. Can you just outline that for me, that time period?
Tan hangatatitau akilirtausimaju iqalunnuuqtitauniaqtu taakkununga qawisartaugutissanik qanutigirneaqqa uhaqqaugavillu ulluunni maqquunni pingasunilluunni utaqqigiaqaqajangata qanutamanna nalunaeriaqunnaqiu.
It's going to vary depending upon circumstances and timing of the plane. But for example, today's flight, it's going to land somewhere around 1 or 2 o'clock. They will collect the samples that have already been collected. They'll offload the rapid response team, collect those samples, and bring them here to Iqaluit. The samples that are intended for our gene expert will be analyzed here, and we'll start getting results within a few hours. The other samples that are intended for the public health lab will be shipped to Ontario and analyzed there. They will be transferred to a regular cargo freighter or a cargo flight, and they'll probably start making that trip tomorrow, which would be Friday, probably get to the lab sometime Saturday, and then be analyzed in turn then. So those second tests we probably won't start to see results back until Sunday at the earliest, but the gene expert, we may see results back later tonight.
Tako ajigi khatta jangitut hangata ju tappa palle ajata na tikilanga matappa nga unno sa wame 2 milionit tako khawi sakat sa you no tawgir simayut hangata yo mo ikitawlutik ihalon notit talekko taima sunakutati no gene expert mo khawi saktawlaglutik ikak amisulo itu tako tirunnak nertut kasi anita ko awlak titaw kanera hamna mi mata khawi saktaw mo Ontario mi tako awlak titaw la tu khangata yuko pikhutik taw tikko talle me khay tikillutinat singo yala na mi taw no khawi saktaw mo khawi saktaw kanelaglutik amalo tukle ani khawi saktaw kanerutit sangit nat singo yame khay tamane ila tamang pigyak kanek taw la tut amalo tay kwali unno mi tikila ngayo tapangat unno sa hawi yaw chauti gunna lang ngayo unno
Unali aperigwa tara qabla na nunangit ni presumed cases data mata Nunavut medikya pitakapa we've all heard that there's the word used presumed cases before. Are there any cases in Nunavut that are considered presumed?
No, not at the moment. When we get more information later today, there could be, but as of right now, no.
Aga man na pitay ma pasagiyaw yun isuli pitakang ito tukisiga kan nero tavat sa ruga kan ni pitakatu na realiw galo tay may tuni kisani man na yo pitakang ito tay ma pasagiyaw to inakto ni
Unat apegayaw lang to daw tungo neryuti ilang ito haktaw himalak mata New York mi ama nunakyo akeni kawayaw himayu nubakyo ang nek 19 wakto taw himayu Nunavut mulang na aktulikya neryutigiyaw yu kawihak taw yaka kakayak pa Nunavut ka pa makaluni tako ni nga ujel yakak pa the question I'm asking now is from a viewer who is asking, talking about the people, well, there's cases with animals down in New York and in other parts of the world that are confirmed cases of COVID-19. Is there a level of information or tools that the government of Nunavut would use when bringing people's pets to the territory?
Go ahead.
Yeah. It's still trying to figure out how often somebody could catch it, or if at all you could catch it from some of those animals. And so there's been no discussion that I'm aware of or that I've been involved with in banning or limiting importation of pets. So not at the moment.
Suli kawi yaw gasawto taman na kanutigi siyang maktawag ng mga umayongnik ukakatawlaw sa mga ito nga tamatungong nitsano kisen tamakun nga umayong no pikutigi yaw yun siyang magunang ningani tusak sa mga ito.
That's a long-winded way of saying I don't know. If I find anything, I'll let you know. But I want to reinforce that there's no concern with traditional country food, tuktu, seal, fish, birds. There's no concern that any of those animals are at risk of having or transmitting COVID-19. So nobody should be avoiding country food as a result of this.
Tan na kiyo juti gay manalo na ako tituin na kawi mangito nga kisa nino na sigaro mayong atako inuliktain inuit nakigayop tangi sumalon nang ituit 2 minute not 6 minute Iqaluit timmiaminillu uluqianarngittuut siarmartitsigutaugajarninginnik taakkualu taimaittuni Nunavummiu neriqattatuinnaquyaujum.
Ken Driscoll, APTN National News. Dr. Patterson, has the patient traveled outside of Pond Inlet or Nunavut in the last 4 weeks?
Last how many weeks?
4.
Ken Driscoll, Luta Patterson apiriu taanau laqattarsimammanga nalunaertawsimayu mitsimataliu silataanu balunavus silataanu aullarsimava.
We don't know all the details of the person's most recent where they've been and that sort of stuff, and I'm not certain how much of that we're going to discuss at any point in any case, because we don't want to contribute to stigma, shaming, or blaming.
Qauyamangittunga taakkua ilulingi sulinalunayarsimangimmata namingmarsimammangata kisiani uqausseriluarunnanginnakku taima ilaliutsigumanginnama kangusuttitsinermi kubbalu kappiasaarinummi tamattumamitsaan.
Thank you. I just wanted to take this opportunity to stress how important some of the guidelines that Dr. Patterson's office has recommended to all Nunavummiut to practice your social distancing, making sure that you maintain just your household. I know there has been some talk of the limit of 5. Still very strongly recommended that people maintain only their households. I think this gives us an opportunity to stress on how important that is.
Qoyannami piviraqtitaugama ilasigiakkannikainnaqamayunga pimmariuninginni taakkua maliktau qoyangiluta Patterson pimmarirugiallammata taakkua Nunavummi suurlu malittaugiali inuuqattigi katiluattailigiaharninginnut angiqamiuqattigiitua katingaqattarlutik taanaluqausiuqattarsamayu tallimainnai katimagunnarninginnik kisiani uqaujigiartunga taakkua angiqamiuqattigiituat taakkutuuqattaqullugi pulaqaqattigiiqattaqungitsugit.
There's been a lot of people, our isolation hubs, the inconvenience of that. We're all challenged with having to maintain or not maintain friendships and contact with our friends and family. We don't want to undo all the work that's been done by relaxing any of these measures right now. So I strongly ask all Nunavummiut to maintain the recommendations as Dr. Patterson and his office have provided to all of us, the directions, and together we will get through this. Thank you.
Amisuunila akaqiyaangittukku qattariaqarsmagaluartillugi anittailititaullutik qallunaani tuyummivinnik ammalu tamakkua piqannariit ubbalu ilagi katiqattarunnariinningit kisiani atsuruutigisamayavu quyanaartautuinnarhunginattigu sangiyumik uqatsiarpunga Nunavummiu taatsumaluutaa Patterson allabingatalu nalunaersimayanginnik suli malitsianginnatuinnarhullugi.